Hello, Dr. Herman here. Welcome back to another great video. In this one, I'm going to share with you the causes of a severe bloating and indigestion that one of my patients suffers. And this is all focused on what is going on within a specific tissue within the stomach called the gastric mucosa. It's also known as the stomach mucosa. In addition to what we found here, this patient is already experiencing tremendous relief of headaches, tremendous release of facial pain and sinus pain and congestion that she suffered for many years. And one day when the rest of her symptoms are gone, she will be filming a video to share of her own experience under my care in my clinic. But in this video, again, we're going to get back to what's going on that's causing her severe indigestion and bloating, and that is multiple chronic infections in her gastric mucosa layer of her stomach. I found on her gastric mucosa layer, without a biopsy, without an electrical bioresonance testing system, with a very unique stressed reflex bioresonance examination that always finds what's wrong in the tissue and always helps provide relief from chronic ailments. I found multiple parasitic infections. I found infection. She had lost a couple of teeth in the bottom of the jaw on the right and the left side of her mandible, of her bottom jawbone, and I found infection in the jawbone that's dripping down into this gastric mucosa layer in her stomach, and also trauma from where the teeth have been broken and came out. I found these are called acathelhelminthic worms, platyhelminthic worms, at a very high level of infection in the gastric mucosa. Nemohelminthic worms in the gastric mucosa. I found a trauma site where the wisdom tooth was pulled. The trauma site, listen, in physics, they have proven that when there is a trauma to a tissue in the body, there's a ripple effect to other tissues. So it can slow down the effect of the function of another tissue. Think about this. If you look at a pool of water or a pond of water, and you take a pebble and you throw it in that water, what happens to that water when you throw that pebble in? It goes from flat with no movement to a ripple effect. Throw the pebble in the water and you're going to see a ripple bouncing away for a very far distance away from where that pebble was thrown in the water. The trauma from the tooth, the wisdom tooth being ripped out of the mouth of the individual, can cause a reflex to the heart, to the thyroid, to the parathyroid, to the stomach, to any tissue in the body. So we found that the wisdom tooth is also causing a weakening of her gastric mucosa from functioning the way it's supposed to. She had multiple parasitic flukes in her gastric mucosa. She has a parasite called Babesia in her gastric mucosa layer. She has a herpes virus affecting the gastric mucosa layer, and she has multiple heavy metals like lead, like arsenic, like cadmium, like aluminum. These kinds of metals that you're familiar with, maybe you've heard them before, saturated into the gastric mucosa layer of her stomach. You tell me that all of these infections and toxins and stresses in the stomach that have never been found with any other laboratory, blood test, internal studies, have never found that she's infected in that tissue. You tell me that her stomach can feel okay when it's got multiple infections. So if you suffer from an indigestion, chronic indigestion, if you suffer from chronic acid reflux as part of your whole overall chronic condition, and you don't get testing like this done that I do, and you continue to suffer and take medications and just hope that the pain goes away, or just living with it because that's what you think is normal, it's time for you to step out of the box and step over to another kind of healthcare. Get into my clinic. Have a very unique examination done, and you're going to find what's in your tissues. That I am certain. And you'll be able to follow a very unique, specific, individualized, soft, non-threatening, non-invasive protocol that's going to help you alleviate your symptoms by eliminating the causes of your symptoms. Stomach indigestion does not have to be, we can get over it. I'm going to report back in a couple of weeks when I see her. Actually, I'll see her in a little bit more than 3 weeks, 3 to 4 weeks. I'll see her again, and I'll be able to report back just about her great relief that I expect her to have from her indigestion, And again, we will be reporting when she's ready to share all of the amazing relief in her body, in her life, in her health benefits that she's been experiencing here in my clinic as soon as she's ready. But again, those headaches are just about gone, and the facial pain gone, and the sinus problems are gone. So I look forward to sharing more with you. Call my clinic at 954-370-3100. And remember, infections and toxins in the stomach lining can lead to indigestion in your body. I look forward to helping you too. Thank you.